Hello, good afternoon to whoever that is watching this video. My name is Ruth Barrow. I'm a public health nurse by profession. Did you know that smoking can be a lifestyle disease by choice? Did you also know that according to the World Health Organization, the effects of smoking accounts for over 8 million deaths globally in a year? Are you also aware that 1.3 million deaths happen in a year as a result of people who are exposed to secondhand smoke? Did you also know that no matter the number of years one has been smoking, one can actually make a decision to stop smoking and regain your health? These and many others we shall be looking at in this video. First of all, what is smoking? Smoking, according to some books, is a practice in which a substance is combusted and the resulting smoke is inhaled and absorbed into the bloodstream. Now, one would ask, why do people smoke if it is that dangerous? People smoke, first of all, some because they are ignorant about the effects of smoke. Some smoke for pleasure. Some people smoke because they want to relieve themselves from stress, anxiety, loneliness, and others. Some people smoke because of media exposure, media influence, maybe from adverts and other related stuff. Others smoke because of genetic factors and some parental influence. Some people also smoke because of peer pressure. Now, when somebody smokes, what happens to your system? Or what are you exposed to? In that sense, we are talking about the effects of smoking. Smoking damages your lungs. It can also cause heart problems or heart diseases. When one smokes, you expose yourself to fertility issues or fertility problems because the substance contained in, the smoke, which is nicotine, has the ability of damaging your reproductive hormones, in that causing low sperm counts and others. Smoking also gives you the risk of developing type 2 diabetes. Again, a smoker's immune system is weakened or compromised because of the toxins inhaled into the system. And once your immune system is compromised, then you can be rest assured that your system cannot fight against infections and other related diseases. Smoking also affects your integumentary system. And here we're talking about the hair, the skin, and the nails. Long time smokers or, people who have smoked for a long time would have their skin being damaged, their skin being wrinkled. You see the teeth being discolored or even the lips becoming brown. You see their nails looking yellowish or brown. And that is an effect of the smoking. Smoking also gives you the risk of developing certain cancers. Not only will you suffer from lung cancer or liver cancer, you can also suffer from colon cancer, kidney cancer, pancreatic cancer, and other related cancers. Smoking again damages your central nervous system, which contains the brain and the spinal cord. Now, having looked at the effects of smoking, one would ask, how does one quit smoking? Is it even possible? While quitting smoking can be challenging, research has proven that people who have been able to quit smoking outnumber those who are currently smoking. That is positive, isn't it? It means that you can actually decide that I am going to stop smoking, and that is possible. Now, if you happen to quit smoking, what happens to you? Research again have proven that if one happens to quit smoking for just 20 minutes to 12 hours, the heart rate and the carbon monoxide in the bloodstream drops to normal. Again, if you are able to quit smoking for 1 year, your risk of heart attack is much lower, as in blood pressure, and other respiratory problems begin to improve. If you quit smoking for 2 to 5 years, the risk of developing a stroke is very minimal to someone who does not smoke. If you quit smoking for 5 to 15 years, the risk of mouth ulcers or throat cancers or esophageal cancers is also reduced by half. That is amazing. If you are able to quit smoking for 10 years, it means that the risk of developing lung cancer and bladder cancer is also reduced. How about if you quit smoking for 15 years? The risk of developing heart-related conditions is very much reduced. That means your system or your heart rate or your heart condition or your heart comes back to normal as that of someone who has never smoked. Now, mind you that quitting smoking is not as easy as you think, but it's possible. The substance nicotine in smoke is a very addictive drug and can cause a lot of withdrawal symptoms when you try to quit smoking. Some of these withdrawal symptoms include headaches, cravings for any other thing. It could be cravings for even the same smoke that you're trying to avoid. You can also have increased appetite and irritability as a result of some of the withdrawal symptoms in smoking. But I want to assure you that it is possible to quit smoking. How do you quit smoking? First of all, you have to make a decision that you want to quit. And that decision, the reason for you wanting to quit, should be stronger than you wanting to continue smoking. And this can be possible by involving your family members, letting them know the decision you want to make so that they can support you. You can also do this by making sure that anything related to smoke, either the cigarettes, either, whatever that reminds you of smoking is being put away wherever you are. You can also do this by talking to a health professional or a counselor. Let them know your decision to wanting to stop smoking, and they would counsel you and integrate you to social groups or social clubs where you have the opportunity to interact with people who were once smokers but have been able to quit. Again, you can stop or quit smoking by ensuring that people who are positive about your attitude of stopping smoking are usually associated with you. You are usually in the company of people who motivate you, people who will encourage you, people who would not tell you this is not possible. So it means that if you were a smoker and now you want to quit smoking, you have to associate yourself with people who are not smokers, people who give you positive vibes, people who will encourage you to quit. Now, a lot of people smoke because they want to relax themselves. Remember, there are other ways of relaxing yourself if you want to quit smoking. You can resort to swimming. You can resort to, exercising, going to the gym. You can resort to playing movies or watching, listening to music. You can also resort to games that will take your attention so that you don't think about smoking. Again, if you were someone who would take alcohol and smoke, or take alcohol alongside smoke, or take coffee alongside smoking, then you might want to consider stopping alcohol intake or avoid taking coffee. You can replace that with maybe taking fruits and vegetables so that you don't get reminded to smoke or to wanting to smoke. Remember, change is a process. And for that matter, it doesn't happen in a day. Making the decision now is what matters. Motivating yourself, having the can-do spirit and the will to do it is what will help you quit smoking. It is possible. If somebody has been able to do it, you can also do it. I just want to encourage you that you can quit smoking and you can be whatever you want to be if you put your mind to it and discipline yourself. Achievement and success shall always be yours. I remain your public health nurse, Ruth. Thank you and see you another time. Bye.